Hello, so welcome to the part 2 of our back and spine region. So this time, let's talk about the kinesiology and the specific regions. First is the available motion in your spine. So, the available motions are flexion and extension, lateral flexion, and rotation. Remember that during lateral flexion and rotation, they are coupled movement, which means that they go together. So the kinetics of the spine. That includes compression, tension, torsion, and shear force. First is compression. Compression usually happens during flexion extension and lateral flexion. So, if the patient or one person flexes, basically there is compression on the anterior part of the spine. Compression. While on the posterior part of the spine, there is a stretch or tension. In lateral flexion, so if the person lateral flex towards the left side, there is compression on the ipsilateral side and there is tension on the contralateral side. Next is torsion. Torsion usually happens on rotation. Basically, there is twisting of the IV disc adjacent to the two vertebrae. And lastly, shear force. Shear force is the forward or backward movement of the spine as well as the side-to-side movement of the spine. Now let's go to the specific regions. First is your cervical region. There are a total of 7 bones on your cervical spine. 3 atypicals and 4 typicals. Remember that the other name of C1 is atlas. The other name of C2 is axis. And the other name of C7 is vertebra prominence. C7 can be palpated posterior on your neck proximal to the thorax because your C7 has the longest spinous process. There are 2 regions on your cervical spine. The upper region starts from the occiput to C2, and the lower cervical region starts from C3 to C7. One of the unique features of a cervical bone is that it has an uncinate process, and the uncinate process, the joint of Luschka. So this part here, a bony prominence on the cervical spine, is your uncinate process. And the joint between those uncinate process is your joint of Luschka. Remember, the joint of Luschka is a functional joint. Its main function is to facilitate neck motion. The facet joint orientation of the cervical bone is 45 degrees oriented, obliquely oriented to sagittal, frontal, and transverse plane, which means that it crosses flexion and extension in sagittal plane, lateral flexion in frontal plane, and rotation in transverse plane. So basically, there is a large amount of range of motion in flexion and extension, lateral flexion, and rotation on the cervical region. So for easy memory work, the normal range of motion or ROM of flexion, extension, and lateral flexion is 45. And the normal ROM of rotation in cervical spine is 60. Now to the specific joints. First is your atlanto-occipital joint or your AO joint. That is the articulation of the occiput and the C1. The motion that is happening on the atlanto-occipital joint is capital flexion and extension. Capital flexion is the anterior downward tilt of the skull, while capital extension is the posterior downward tilt of the spine. Next is atlanto-axial joint. Forms between the atlas and the axis. Motion happening on the atlanto-axial joint is cervical rotation. And your atlanto-axial joint is the most mobile joint in the cervical region. The bony prominence that is unique in C2 is your odontoid process, or also known as dens. That bony prominence facilitates neck rotation. And on that bony prominence, there is an alar ligament, which limits excessive rotation. Next, to the lower cervical segments. So the motions available are cervical flexion and cervical extension. Then you have your lateral flexion, and rotation. So lateral flexion and rotation are coupled movement. So during an ipsilateral lateral flexion, it is followed by an ipsilateral rotation. And during an ipsilateral rotation, it is followed by ipsilateral lateral flexion. So that ends our part 2.